Another athlete collapses on the field. This time, a Belgian soccer goalie by the name of Arne Espeel collapsed suddenly and died. He was 25 years old. We're going to discuss what happened here. And so from Trial Site News, I am Adrian, and our episode is starting right now. So, Belgian goalkeeper Arne Espeel died this past Saturday, moments after saving a penalty for his team. As the New York Post reported, according to reports in Belgian media, Espeel saved the spot kick but dropped to the ground afterward. Emergency services rushed to help Espeel and tried to revive him with a defibrillator, but he was pronounced dead shortly after he was taken to a hospital. The cause of death has not yet officially been determined, and an autopsy was scheduled to be carried out on February 13th. Now, members of Winkelsport B spoke out about the incident. Assistant Stefan Derwitchen said about it that the ball was still in play. Our goalkeeper got up as fast as possible to receive the ball, but then he fell. It was really terrible to watch. All the players showered together after the incident. When the message came that our goalkeeper was dead, it was an unusually heavy blow. I think some players still didn't realize exactly what had happened. And then you have the Winkelsporting director, Patrick Rotsart, who said this: "This is a disaster and a shock to everyone. Arne has been with the club all his life and was very loved. He was a wonderfully sympathetic boy, always in a good mood and ready to help. This is really a heavy blow, first of all for his family and also our whole club." And the club itself issued a statement that read, "Winkelsport is in very deep mourning at the sudden passing of goalkeeper Arne Espeel. We wish Arne's family and friends our heartfelt condolences at this heavy loss. Football is taking a back seat for some time." Now, the news of his death has gained some attention. ESPN announced in their Twitter feed about it, saying, "Belgian goalkeeper Arne Espeel died after he collapsed on the pitch on Saturday moments after saving a penalty for his team. He was 25. And the response to this tweet was immediate. Many people were trying to preemptively try to attack anyone who might suggest this tragic and untimely death to be the fault of the vaccine, while others were putting forward that very question. An example of this would be Twitter user John Ziegler, who said, "To review, a 25-year-old in perfect physical shape collapsed and died on the field of cardiac arrest just moments after experiencing the adrenaline rush of having made a big play. Sounds really familiar. #DoNotAskQuestions. Or this Twitter user with a Valentine meme of Fauci with the words, 'You make my heart stop.'" Now, these reactions aren't surprising. With so many high-profile instances of athletes and media personalities suffering injuries or fatalities and in such a public fashion, the demand for answers is growing. And it doesn't help when the narrative pushed by those in leadership roles attempt to blame anything and everything but the vaccine. It could be deferred health visits, worsening diets and stress during the pandemic, or even just other background factors, just not the vaccine. Now, naturally, this only serves to make people suspect the shot even more. Of course, you can't prove causal relationships between these incidences, but it's a question worth asking. And telling people they can't, well, that's just nonsense. You would think that there would at least be some consideration for the potential cause. I mean, even the WHO has now acknowledged for quite some time the link to myocarditis and the COVID-19 vaccination. They covered all of this all the way back in 2021, saying this: "Very rare cases of myocarditis and pericarditis have been observed following vaccination with the mRNA COVID-19 vaccines. These cases occurred more often in younger men and after the second dose of the vaccine, typically within days after vaccination. Current evidence suggests a likely causal association between myocarditis and the mRNA vaccines. More rigorous studies using alternative data sources and more robust study designs, including comparison of unvaccinated and unvaccinated populations, as well as investigations monitoring for longer-term follow-up, are underway." And the WHO goes on to say that vaccinated individuals should be instructed to seek immediate medical attention if they develop symptoms indicative of myocarditis or pericarditis, such as new onset and persisting chest pain, shortness of breath, or palpitations following vaccination. Now, the World Health Organization would go on to stress that the benefits of the vaccine far outweigh any risks. But Once you understand that the risk is real, and that we do have quite a number of documented cases now that we can point at, you would think that this would at least be taken seriously as these cases continue to crop up, right? But no, the attempt is on to try and gaslight people into thinking that it is the one possibility that is impossible. No way it could be the vaccine. You people are crazy. An example of this would be outlets like the Daily Beast, who declared that right-wingers peddle anti-vax BS about MSNBC host's health. Remember her? Remember Yasmin Vasugian? We covered her story on this channel back on February 1st. The MSNBC anchor spent a month in the hospital, and when she returned to work, she revealed that she had been hospitalized with pericarditis and myocarditis. At the time that the video aired, her doctors were claiming it was caused by the common cold. As Yasmin would put it during her segment, it was just the cold that was doing all the inflammation in and around my heart. She even brought on her physician, Dr. Greg Katz, who is a cardiologist at NYU Langone Hospital, to discuss the growing outcry from the public over claims that more and more people are now suffering from pericarditis and myocarditis. Dr. Katz suggested that the reason behind all of this could be the season is more virus-heavy. Maybe our immune systems are different. Because we've been masking and social distancing. Nobody knows why this is. Now, naturally, this story caused social media to light up, with many strongly suspecting it wasn't the common cold that was responsible, but perhaps something else, possibly even the COVID vaccines. Which brings us nicely back to the Daily Beast, who mockingly put down those who might suggest it is related to the COVID vaccination, saying, anti-vaxxers have long glommed on to the fact that a small number of myocarditis cases have been reported after mRNA COVID-19 vaccinations. The Daily Beast would go on to complain that despite the CDC's claims that the side effect post-vaccination was rare, that none of that had ever stopped the anti-vax script machine from churning. And this then takes me right along to Damar Hamlin. Remember him? A football player who suddenly collapsed moments after completing a tackle on national television during a Monday Night Football game, back in early January. Thankfully, doctors and trainers administered CPR and used a defibrillator on the field to resuscitate him, and he survived. The official report was that Damar Hamlin went into cardiac arrest, his heart stopped beating, the cause of which hasn't yet been determined. This was a major news story at the time. When interviewed about all of this and asked what his doctors described happened to him, Hamlin declined to comment. Listen to this.
After Hamlin was discharged from the ICU, the question on so many minds, what caused his heart to stop beating?
You're 24, peak physical condition, can run circles around me right now. How did doctors describe what happened to you?
That's something I want to stay away from.
Now, when probed a bit deeper, asking if he had ever experienced any heart problems in the past, Hamlin responded with, honestly, no. I've always been a healthy, young, fit, energetic human being. And according to Damar, his doctors are still in the process of diagnosing what went wrong, and that he hopes to return to playing football. Now, all three of these stories are deeply concerning, and while it is true you can't prove a causal relationship between these incidences and the vaccine at this time, to arbitrarily suggest that it couldn't be vaccine-related, well, that's just gaslighting at its finest. In any case, we of course will be keeping an eye on this developing story as it moves forward, and naturally we'll keep you posted on it. And that, my friends, will bring our episode to a close once more. For more content like this, be sure to check back to this channel daily, Monday through Friday, or for written content, check us out at trialsitenews.com. And as ever always, my friends, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.